Naveen, my friend, it's so good to see you in Chicago. The first annual HemOnc Pulse podcast live meeting, and we're going to do it next year. But we just had a great session that you led on the unanswered questions in MPN. I have to admit, before you tell me these top several questions, I am genuinely flabbergasted by your first slide, which had, and I tweeted that, which had so many therapies that are happening and how much you have to update. This is really amazing. So take us through, in your mind, with all of this progress, what are these top 3 or 4 questions that you are working on as a research field community?
I'm happy to do it, but before I do it, I have to thank you for having the vision to have a meeting like this, where we had folks from myeloma, MPN, AML, ALL, T lymphomas to get together, because there were common themes, Chadi, that we saw throughout all of these tumor types that I myself had not seen before this meeting. MRD, disease modification, some of these things, so that's credit to you. Here in the MPN session that you had us do together, we addressed 3 major questions. One was, what about the response criteria beyond JAK inhibitor monotherapy? We started out with spleen and symptoms, led by Ruben, Serge, Claire, and others. But now we have combination therapies, mutant-specific therapies, immune therapies. I asked the question to the panel, shouldn't we be considering something beyond that? Overall survival, progression-free survival, EFS, as is done in other tumors. The second topic that we talked about is 2 drugs better than 1? Combination therapy up front. Our myeloma colleagues, our AML colleagues, ALL are already there. But as we heard in CLL and MPN, diseases that have maybe a different cadence, maybe a more indolent disease phase, is 2 drugs better than 1? And so we debated and discussed that. And then finally, we asked Dr. Sanam Lagavi, our superstar heme path colleague, are there any biomarkers that we're missing that we can discover, surrogate endpoints, biomarkers, something to tell us that our drugs are working and the disease is reducing? So those are some of the topics.
So focus on the last one for me just a little bit. You want something beyond just clinical bone marrow biopsy, fibrosis, spleen size. Is there anything right now there, or is this is completely, we have 0? Are there certain things that look promising as potential biomarker?
I'm going to say yes and no to that, and I love what you said. Yes, that's what I will have a call to action as of this moment to the field to do exactly what you said. And Ruben mentioned it too. I want my patients to live longer. I want them to feel better. But I want to capture that with the metrics that I don't think we're doing right now. And so to capture OS, PFS, EFS, we may need something at the level of fibrosis reduction, allele burden reduction, cytokine modulation. And most of the drugs we have so far have not met that bar, but we're not following them long enough, as was mentioned on the panel. So I'm calling for longer follow-up, more clinical translational studies, and the identification of some of these new markers. We may be missing something in plain sight that can guide us for future drug development.
Well, thank you for spending the time, and hopefully by the time we do this next year, we will have more progress. Thank you so much.
I wish you all the success. Thank you.